So, good evening, everybody, or good morning, wherever you are. It's 4 o'clock in the afternoon in Finland, where I am. I am Sanna Hakala, event coordinator at LM Dental, and I have the honor to be the host this evening for a friend and an excellent professional, Tatiana Brandt, who is a dental hygienist and also clinical lecturer at School of Oral Healthcare, University of Copenhagen. This evening's topic is effective instrumentation with LM Dual Gracey. Tatiana is gonna tell you about it about 30 minutes. End of this presentation, we have still time for questions. You should have like a screen where you can see icon for raising hand. So if you have a question, you can raise your hand and I can unmute you. You can either ask it yourself or you can type it in the questions section, and I try to read it out loud. I hope I know all the words in your area. We also have a poll question in the middle. And what else? Yeah, we have two handouts also in the system. You should be able to download them. Clinician's choice, which tells you about the minimal set of instrumentation. Tatiana gives you a good hint. And effective instrumentation, also a couple of slides from our clinician's choice concept. So that's about what I have to say. I'll give you the stage now. Tatiana, go ahead.
Thank you, Sanna. And my name is Tatiana Brandt, and I'm delighted to welcome you all to this dental webinar, where we will explore together a new concept about periodontal instrument selection. This concept takes account in rich diversity of our patients and also unique perspectives of clinicians. I believe that this concept will benefit both experienced dental hygienists and dentists, as well as beginners. This concept has several benefits, but the most significant one is economic benefit, with the gain of time saving and emphasize focus on professional personalized periodontal treatment of patients. And I really hope when I use so much of my energy and patience for these cases, you can use it in your practice. Enjoy it. I promise not to take up too much of your time introducing myself. You can find all details about me right here on this slide. And please feel free to get in touch with me for additional details or maybe potential collaboration. I love talking about periodontal instrumentation, and I would be delighted to share ideas and maybe collaborate on future projects. This concept chosen by the clinician involves three distinct hand instrument sets. Three cases descriptions are designed in such a way that each instrument set can be utilized depending on the clinical characteristics of the patients. If you are having your comprehensive patient for the first time treatment, you are picking up the Gracey sets. If you are a very experienced clinician, you are working with lung accurates. And if you dealing with a recall patient, you are going to Dual Gracey. So chosen by the clinician, cases created like shorter versions of study books. There is clear instructions and videos. Any practitioner can use in periodontal practice. To ensure feasibility, each set should consist of only a few economically viable instruments and thereby minimizing the need for excessive sterilization. Today, I will delve into the details of the Dual Gracey step. It's my favorite one. The description of the cases, along with accompanying PDFs and videos, can be found on the LM Dental website, and cases presented as case documents and illustrative case videos. I removed the gingiva from these typodons, in this case images, to provide a view of the working end of the instruments. I think it's quite important that you can follow reading these cases, how I apply and follow the fulcrums and the position of instrument tip. It's right crucial. You can also find pliers as support material, and they include basics for the case and instrument in questions. I experienced that my students think it's very nice to use QR guide to more detailed materials. You can just scan it with your mobile phone, and you are going to more detailed videos and PDFs about cases. Very short, just 8 to 10 minutes videos will demonstrate instrumentation just step by step with proper fulcrums and scaling strokes. And I would be happy if you can use this video in your daily practice. Let me start with a brief introduction to clarify the background for these cases. Do they based on my clinical experience? Of course. But do they also based on scientific literature, on textbooks, on the recent articles? Yes, of course they also do. Based on my experience with exhibitions and hand-on courses, I've noticed that many dental professionals tend to stick with the same periodontal instrument they learned about in dental schools. Sticking to your favorite instrument can be beneficial since you become very skilled with them, and I can understand that it is more comfortable to work with tools that have been proven effective and safe, while transitioning to something new, like new instrument set, can be challenging. That's why I recommend not making a significant change of your daily work routine, but instead focusing on refining your instrument selection to enhance efficacy. And the key question for me today, and for probably all together, to consider is whether we truly require such an extensive array of instruments for periodontal treatment. And my response, my answer on this question, it's not necessary, but I think it is advisable to establish a systematical approach to their selection. All Gracey carets are very rarely used at the same appointment by clinicians. A set of 3 or 4 appropriate instruments may be enough to the entire dentition instrumentation. What really matters is understanding how these instruments are designed, so we can pick the right ones for each patient. Sickle is my favorite instrument, and what is a sickle? It's a scale, but it needed to be used with a combination of curettes, either universal curettes or maybe area-specific curettes, or maybe both. I just can't understand how just one sickle can be effectively used for a patient with significant bone loss and deep periodontal pockets. It seems quite challenging to get good results. And to be honest, it is even harder to tell dentists and dental hygienists on my hand-on courses that they might not be doing as well as they think. They should use instruments that perfectly adapt to the root surface, which a sickle with a very straight tip can't do in deep pockets. So, shall we keep it classic because our patients deserve a slice of that good old-fashioned time-tested excellence, or shall we follow the progress? The design of periodontal instruments, including their shanks, handles, steel composition, and protective coatings, has undergone significant development over the past few decades. The Gracey series is now offered by LM Dental in a range of variations, including rigid, standard, mini, and macro versions. Macro is my favorite. Sometimes it's really difficult to decide what to choose. And my cases, they can be a great help if you are a beginner or just an adult. So let's follow the progress and let's give our patients the VIP treatment they deserve with the latest and greatest instrument in sound. Of course, you're aware of that the patients are not the same. There is a huge diversity in their periodontal status. Calculus deposits. So why do we need and why do we treat them with the same instruments? Is it wise? Is it rational? Is it economically benefiting? When planning calculus removal, some questions needed to be answered. Which of the periodontal instruments should you select for calculus removal on the posterior and anterior teeth? Sickle scales, universal curettes, or area-specific curettes? What anatomical features present a challenge for this patient? What type and size of calculus is detected? What type of gingival phenotype has the patient, thin or thick? Of course, you know that efficacy of non-surgical periodontal instrumentation depends on many factors, such as gingival inflammation and root anatomy and pain management. And of course, clinician experience and your skills and understanding of periodontal pockets anatomy, and they play a crucial role in subgingival instrumentation. And I think we need to have in mind all these factors, choosing periodontal instruments, or maybe a combination of these. It's my belief that dental practitioners should be educated to select a variety of instruments, or maybe a combination of these, based upon the parameters described. Having this in mind, I first created specific tool sets for students in their first, second, and third years, based on patients with different periodontal features and student skills. And the feedback I've received from both students and colleagues has been positive. To next year, we are going to improve this instrument selection. And now we are going to help students with some additional text underneath this instrument boxes. What type of calculus deposits, what type of patient it would be preferable, just to nudge them to choose the right instrument for their treatment. I presented my idea about creating 3 minimalistic sets for dental practitioners at LM Sales Exhibition in January 2022. And then after I went to a Europeria event in Copenhagen, I felt sure that I was doing the right thing. Several speakers highlighted the EFP's S3 level clinical practice guideline, employing a predefined step-by-step method with subgingival instrumentation as the second step. Implementing this guide in non-surgical treatment is straightforward, and despite the uniqueness of our patients, the systematic approach proves to be highly practical. And I think that the concept of creating uncomplicated instrument sets aligns with the guiding principle. Let me summarize. My concept focuses on optimizing the quality of periodontal treatment while minimizing time investment, and of course, on education. It is recommended in my cases that subgingival periodontal hand instrumentation is performed in combination with powered ultrasonic instrumentation, considering that instrument condition and sharpness are critical in providing of successful periodontal treatment. Of course, I am aware that you can do a periodontal treatment with hand instruments alone, but I'm taking care of hand feet and fingers, and that's why I want to start removing the majority of the calculus with ultrasonic devices, and then go further with hand instrumentation. Let's look closer at the periodontal cases created for this concept. The first one I'm gonna describe in details a little bit further. It's dual Gracey set. Number two, it's instrumentation with Gracey curettes, classical ones, but with a little twist, and effective instrumentation with longer curettes. Case number two. This case is based on a combination of different types of Graceys. Usually you are buying mini Gracey or macro Gracey or standard Gracey. What I'm doing here is a combination of Gracey, macro Gracey 13, 14 and mini Graceys 11, 12 and 1 and 2. This instrument set is perfectly suitable for comprehensive periodontal treatment of patients with proben depth more than 5 millimeters, maybe equal with 5 millimeters. Where soft tissue is quite inflamed, and you need to do it very, very carefully for the first time. But in this instrument set, I'm using a combination of area-specific curettes and universal instrument, sickle, mini sickle. I always use scale for doing perfect finish and also for fracturing of eventually burnished calculus. I can't avoid sickle. So a combination of curate and sickle is just must in all these sets and the main principle. Case number three, it's created for an experienced clinician and very suitable for a hard tenacious deposits. Sickle is very good for removing tenacious calculus because of a strong, rigid working end and a pointed tip, which provides a good access to proximal surfaces. And longer curate, it's universal curates, but they're designed a little like Gracey, and I think it's pity that they're forgotten in practice. I know a lot of clinicians use them in surgery, for example, and they're perfectly adaptable for deep pockets, scaling of deep pockets, and of course removing more tenacious calculus because of this angulation and your fulcrum position when doing it. And the case number one, this effective instrumentation with LM Dual Gracey curettes. I'm quite sure it's gonna be bestseller. This set includes mini set. It is a combination of universal curate and mini Gracey 1, 2 and mini Gracey 7, 8 curettes. Another one, green one, it is a mini set. The first one, it was the mini set stereo, yellow one, and the mini set anterior. This one is the green one. It's a combination of green one, a combination of 1, 2 and 7, 8. You have this sickle LM23, blue one, and Banhurst. Banhurst, it is a universal curate. Working with the synthetic version of Gracey you will become more time efficient when treating a recall patient. Scaling a well-treated maintenance patient or a patient with gingival retraction is easier to manage. You bleeding reduction and small amount of newly emerged calculus and more firm, soft tissue. Here you don't really need a Gracey set. What I mean, a classical Gracey set. That's why a combination of synthets, it would be just perfect. I think it's very necessary to understand the differences and the similarities between Synthet and Gracey to choose the appropriate Synthet version and the right additional universal instrument, either for deplaquing of 4 occasions and finishing strokes or for calculus removal. Each LM Dual Gracey tip has 2 elliptical cutting edges, a mesial and a distal edge. The lower shank is needed to be kept totally parallel to the tooth surface while scaling, as with Gracey. LM Dual Gracey are suitable for vertical, horizontal, and oblique scaling techniques, and I will show you later how to do these horizontal and oblique strokes. These instruments can be adapted to both the mesial and distal tooth surfaces without changing instruments, and it's just great. You can use the same instrument, not switching between the working ends. Mini sets are appropriate for light scaling and deplugging in periodontal maintenance patients with tight pockets, and this patient is just right for this kind of patients. Standard synthate is more recommended in the same combination with Banhart 5.6 and Siegel LM23 for initial periodontal treatment and removing some bigger calculus deposits. Mini sets anterior LM sharp diamond, and not to confuse you, this green one, designed for removal of supra and subgingival calculus in premolar and anterior areas for all tooth surfaces, especially suitable for scaling of grooves, concavities, and depressions on mesial and palatal sides. I love using them on first premolar, and additionally, they can be used on straight root surfaces in 4 occasions, but not on ceiling and bottom of 4 occasions. Mini set posterior, the yellow one, designed for removal of supra and subgingival calculus in premolar and molar areas for all tooth surfaces. Additionally, it can be used on root surfaces in 4 occasions, but not on ceiling and bottom of 4 occasions. That's why I'm using Banhart in this set, because it is a universal curate. It's very suitable for ceiling and bottom. Used in this case for light scaling of ceiling and bottom of 4 occasions. It's very tiny, fine instruments. Can also be used like a universal curate and in a whole tooth set if deposits are predominantly small and located just under the first 3 millimeters of gingiva. Sickle LM 23, you can alternatively use mini sickle. Here you're using it for finishing and evaluating vertical strokes in proximal spaces. You can use it in the whole tooth set, and you can also start with this instrument if you can feel there are some maybe punched calculus just for fracturing. And I believe it's time for polls, Anna.
Yes, that's correct.
We have one question for our participants.
Yeah, I will read them out loud since you are not able to see them, I believe. There you go. We are asking you to pick one feature of the LM Dual Gracey instrument. And the question is, what distinguishes LM Dual Gracey instruments from traditional Gracey curettes, highlighting their advantages? And the options are, the instruments are designed exclusively for supragingival cleaning. Instruments feature a single cutting edge for efficient tartar removal. Instruments are unsuitable for patients with furcation involvement, or instruments offer supra-subgingival access, both mesial and distal surfaces. So if you could kindly pick one option, and I will then read out loud the results in a couple of minutes. I would like to have few more answers, but the result is quite clear, I must say. I think that's it. There you go. So it looks like 87% of the listeners picked that the Dual Gracey instruments offer supra-subgingival access both mesial and distal surfaces. Only 5% picked they are designed exclusively for supragingival cleaning, and 8% answered that they feature a single cutting edge for efficient tartar removal.
Thank you, Senna. Thank you for having this poll.
Did you hear the answer?
No, yes, I hear the answer. Yes, it's great.
Yeah,
it's great.
Yeah,
and we can proceed right now.
I can hear you right now. Tatiana, I think you muted yourself accidentally. Now
Yes.
I can hear you.
Yes.
There you
yes.
go.
We are proceeding to the practical part of this show, and it is my favorite one where I learn how to do this with synthetics. It's recommended to start periodontal instrumentation from the distofacial line angle to the midline of the distal surface on molars and premolars. And I prefer starting on the first quadrant and continue making a series of short, precise strokes across the distal surface using mini synthetic posterior. You need to watch the bend between the lower and upper shank. It's pointed distal as shown here. You can just remember V, this bend V is pointing to D, distal. Use a series of precise overlapping horizontal strokes and oblique strokes for the distal and facial surface of the posterior teeth, beginning at the distofacial line angle. Horizontal strokes are very effective in removing deposits from the distal line angle of posterior teeth. And the third tip adaptation of the working end is the same as with Gracey. Adjustment of lateral pressure is dependent on your fulcrum and your stroke technique. I'm doing it occlusal here, but I can also do it facial on the next tooth. Move on and continue instrumentation at least halfway across the mesial surfaces. From the facial aspect, using the same working end of mini synthetic posterior. Then use some horizontal strokes, facial if necessary, and if the soft tissue is quite loose. Horizontal strokes are also effective when it is a lack of labor tooth, as depicted here. Proceed to the palatal or lingual side with the same instrument, using another working end if necessary. Place the synthetic posterior with the toe, aiming toward the mesial surface, and gently slide the working end onto the gingival margin. Make a series of horizontal overlapping strokes in mesial direction. You can continue scaling with mini synthetic posterior of distal and mesial root aspects of forcation, doing vertical strokes. Scaling of forcation can be done with a combination of two instruments, synthetic posterior and Panhard, as shown here. Notice a different fulcrum position and applying different lateral pressure using synthetic and Panhard. It is recommended to use very light strokes in bottom and ceiling of forcation, occasionally using a diamond file for extra polishing, but not for starting with. Completing a maxillary and mandibular quadrant on one side of the mouth before proceeding to anterior teeth is recommended, especially when local anesthesia is indicated for 2 quadrants, and because the maxillary arch can be more difficult to scale. I recommend to use very light strokes in bottom and ceiling of furcation. We need to respect a short distance to the pulp. You can do the anterior teeth instrumentation, starting with scaling all surfaces toward to you with synthetic anterior, then rotating using the same working end, the instrument, and scaling all surfaces away from you on the facial, as you do with Gracey. But you don't need to flip an instrument. You can also choose finishing one tooth and moving on to another. It's just up to you. It's quite easy. It can be appropriate to use synthetic posterior on anterior teeth. I love doing it, being inclined backward when the angulation of synthetic anterior is challenging. It is a common scaling mistake that the scaling strokes with mini-sized instruments do not extend past the midline of the proximal surfaces. It is therefore recommended to finish instrumentation doing some vertical evaluating strokes on proximal root surfaces and some scaling strokes just under the contact points with a sickle, as I showed here on this picture. Despite that sickle is not recommended for use on root surfaces, it is excellent for detective evaluating strokes and removing the small pearls of calculus on the middle part of distals and mesials. That's why I always use sickle scale. In this case, it will be recommended choosing a sickle LM23, but I've heard that there is a new sickle 23 on the way, a slim one, and I'm looking so much forward to try this. It's gonna be a great instrument. Sickle LM23 has a shorter blade and a longer lower shank, which make it very, very good for using on the posterior areas. And it is very nice for maintaining periodontal patients. As alternative, the mini sickle can be used, this red one, for the same purpose. When doing short, powerful vertical strokes proximal, fulcrum in lower jaw is placed more posterior to working area. Use very short, precise, fracturing horizontal strokes if calculus tootsie niches, and light if you are just making evaluating strokes. And only 1 to 2 millimeters of a tip is used here to avoid soft tissue trauma. Remember, all these instruments are designed to protect, not to damage the tissue. For better spooling effect and removing the tiniest deposits at the bottom of pocket, a slim periodontal ultrasonic tip, preferably 40H, can be additionally used. Following evaluating with Explore 1112. And now we are nearing the conclusion of this webinar, and it is time for main points. The purpose of creating of basic periodontal sets is simplifying of instrument selection and providing less switching between instruments, time saving. Clinician choice of hand instrument sets will illustrate in a very simple way a professional approach to a time-effective and rational use of only few periodontal instruments. And demonstration of different instrument sets aims to meet individual clinician needs and preferences. And in addition to this, aims to adjust instrument choice to patient disease extent and severity. And now I want to thank you for being with me and finishing this webinar with a picture of a happy patient and a photo of a beautiful country, Denmark, concluding that what we are doing here is oral health care with just a little bit of Danish precision. Thank you very much for your attention. and maybe we have some minutes left for the questions.
We have definitely time for questions. Remember that you can ask yourself if you want. I can see if you raise your hand and I can unmute you. Or you can type the question in the questions part. I think your presentation was quite complete, Tatiana, since there are no questions.
And it was the whole point with this presentation and also designing these cases. It's very easy to use, and you've taken this very little case study book and you can use it to different patients. And if you don't like PDF and my beautiful photos, maybe you can use this short illustrative videos. And really, really hope it can help you or maybe inspire you for the choose sets of instruments.
I am quite sure, Tatiana. Oh, there is a question.
There is one.
Oh, it says it's actually a comment more. You cannot see it, so I must
yes. And what does it
read
say?
it out loud. It says that you are fabulous. Thank you for sharing your knowledge and passion. Love from Beth from Canada.
Thank you. Thank you to Canada, and thank you to all of them who was supporting me. And big gratitude to LM Dental in collaborating on this project and supporting me the whole way with producing these cases and believing in this concept. Thank you.
Thank you, Tatiana. I think this was very pleasant 40 minutes. And since there are no questions, I think it's time to wish everyone very nice weekend. Bye from Finland.
And bye from Denmark.
Bye-bye.